Assalamu alaikum. Today I invite you to participate in a short classification exercise regarding classification of facial peri-implant soft tissue disease deficiency. BSTD is abbreviation of peri-implant soft tissue dehiscence. Definition and importance: soft tissue apically located to the ideal position of the gingival margin of the adjacent natural tooth. Importance of this classification is for diagnosis and facilitate communication among clinicians and proper treatment planning and aesthetic purpose and other. Etiology and risk factor related to the patient: insufficient soft tissue volume, poor oral hygiene, and systemic disease. Etiology and risk factor related to the clinician procedure: incorrect implant position, traumatic surgical technique, and lack of keratinized tissue. Clinical manifestation of BSTD: exposure of the implant, product depth greater than 5 mm, bleeding, and visible pain. Assessment method: by visual inspection, probing technique, and radiographical investigation such as periapical radiograph. Classification of BSTD: this is separate examination for each class and subclasses. BSTD is classified by the Kulle 2019 into classes and subclasses, and class based on the level of the gingival margin, and subclasses into based on the height of the interdental papillae. Each class has subclasses except class 1 don't have subclass C because it is difficult to detect clinically. Class 1, the soft tissue margin is located at the same level of the ideal position of the gingival margin of the adjacent natural tooth and the implant visible through the mucosa. Class 2, the soft tissue margin is located apically to the ideal position of the gingival margin of the adjacent natural tooth, and the implant support the crown is located bilaterally to the imaginary line that connected the crown of the adjacent tooth at the level of the gingival margin. Class 3, the soft tissue margin is located apically to the ideal position of the gingival margin, and the implant supported crown is located facially to the imaginary line that connected the adjacent crown at the level of the gingival margin. And when the implant support crown removed, the implant head inside the imaginary line. In class 4, more apical migration compared with the ideal position of the adjacent natural tooth, and the implant support crown is located also facially to the imaginary line, and when implant support crown removed, implant head outside the imaginary line. So can differentiate between class 3 and class 4 by remove the implant supported crown. We'll see in the class 3 implant head inside the imaginary line, while in class 4 implant head outside the imaginary line. And each class is subdivided into subclasses: subclass A, subclass B, and subclass C, except class 1 don't have subclass C because it is difficult to detect clinically. In subclass A, the tip of the both interdental papillae is 3 or more than 3 mm coronal to the ideal position of the gingival margin of the implant tooth. In subclass B, the tip of at least one interdental papillae is more than 1 mm but less than 3 mm coronal to the ideal position of the gingival margin of the implant tooth. This is imaginary line for ideal position of the gingival margin. While in subclass C, the tip of the at least one interdental papillae is less than 1 mm coronal to the ideal position of the gingival margin of the implant tooth. Please copy the link inside your Google browser. Here, add copy paste. Just click enter. Will open the survey of classification. It's title of classification, the reliability of the assessment of the classification for facial peri-implant soft tissue deficiency, and have also first part demographic data: age, gender, your specialty, and second part contain clinical picture of implant tooth. Now we'll explain how to choose the classification based on that classification we have discussed. We choose this case: soft tissue margin is apically located compared with the ideal position, and we'll remove the implant supported crown, implant head outside the imaginary line, so classified as class 4. Regarding subclasses, we can draw imaginary line from the gingival margin of the adjacent tooth to the imaginary line of the ideal position of the gingival tooth. We'll see the distance from the tip of the internal papilla to the imaginary ideal position of the gingival margin here. This distance is 3 or to 1 millimeter, so classified as subclass B. So this classes, as example, class 4 and choose subclass B. Thank you for your attention.